Already this week, we've talked about a few medical issues that could save your life. This morning, we're going to start off talking about a procedure which could make surgery much easier on you. It's the benefits of minimally invasive robotic surgery. So here to tell us more is Dr. Abir Adib and Dr. John Rutkowski from Kaleida Health and Millard Fillmore Suburban Hospital. Good morning, doctors, and thank you for coming in. And really, I know you have busy schedules, but this we're hearing about more and more. What is minimally invasive robotic surgery? And doctor, we'll start with you.
Minimally invasive surgery is surgery through small incisions. Instead of the conventional surgery where you used to have about a 4 to 5 inch incision, minimally invasive surgery is through small little incisions, which gives a patient a quicker recovery, quicker return to their daily activities, and less infection, less bleeding, less complications. So it's really the future of surgery, and it can be done either laparoscopic or robotic.
And Dr. Rutkowski, you've been doing this over at Millard Fillmore Suburban for a while now, and you can do a lot of different procedures this way.
That's right. As a urologist, we take care of anything in the abdomen that's related to the urologic system, such as the adrenal glands, both benign and malignant causes, the kidney, partial removal or total removal of the kidney, the ureter, bladder, prostate. So many of the surgeries that were once done open can now be done robotically.
And we're seeing from the pictures that that's the doctor behind the controls, and we're seeing just how small and how precise you can make what you have to do there in the patient.
Absolutely. And this is the benefit of robotic surgery, is that through these small incisions, the benefit to the surgeon is enhanced visualization. You feel like you're in a 3D immersed field where the accurateness and precision is unsurpassed. You are able to perform very complex, delicate procedures and remove organs and perform reconstruction with enhanced capabilities with wristed instruments and visibility, and just amazing.
It's wonderful. So doctor, you're being more precise, and the patient is going through less trauma, so to speak, to the body.
Right, that's one of the advantages of this surgery is the incisions are relatively small, and so less pain is that's an added benefit, a really important benefit to the patient. So certainly less pain, quicker recovery. In certain surgeries, less bleeding, less risk of transfusion. So those are all the added benefits of robotic surgery.
That's great. Dr. Abib, what kinds of surgeries can we do now with robotics? What can we take care of through minimally invasive robotic surgery?
The list is growing. It's really amazing. I think at the forefront it was urology and gynecology, especially at Suburban Hospital. And now we've got almost 7 specialties and subspecialties that are doing robotic surgery, urology and urogynecology, as well as gynecology, infertility, GYN oncology, colorectal surgery, general surgery. All these specialties collaborate on a regular basis to provide the best care for the patient. So you'll find 2 specialties working on the same patient in the same hospital, in the same OR, which is really amazing.
And when I think about how marvelous what you can see is really over the benefit of the naked eye. It's amazing how it's, you're looking at things magnified. You could probably see things that you didn't think was there before.
You can,
right?
When you can see certainly much better than your eye.
Right.
And when you're working on precise movements, you can get up to a centimeter distance from where you're working. And also the instruments that we use are much more precise even than your hand. They can do movements that I can't do with my wrist. So so those are all great benefits.
That's wonderful. And we want everybody to know that there is also a specific surgical team for these procedures that do this all the time, right?
Yes, we have a very dedicated OR team that consists of anesthesia and nurses, scrub techs, and all these people are doing robotics every day, so they're really important to our daily schedule, and we rely on them very heavily, so I think it's really nice to have.
Well, we're thrilled that we can rely on you. Dr. Abir Adib and Dr. John Rutkowski from Millard Fillmore Suburban. We want to thank Kaleida Health for bringing us this information, because folks, let me tell you, this is the wave of the future, and the outcomes are terrific, and it's much less stress and trauma on the patient. So by all means, ask these folks if you have a surgery coming up, or you have a procedure that's going to be down the road, to see if it can be done this way, and really learn more about this, because it's to your benefit. Thank you, doctors. Thank you so much.
Thank you, Linda.
We'll take a quick break and be right back.